Hey everyone, we're going to discuss a subject that's very important in our field and to the patients that we serve, and is also very prominent on the board exams that we take in order to enter the field. This subject is cardiac disease, and the key words that should tip us to develop a cardiac related care plan. Some statistics from the CDC says that about 610,000 people die of heart disease in the United States every year. So that's 1 in every 4 deaths is due to heart disease. It's the leading cause of death for both men and women, and more than half of the deaths due to heart disease in 2009 were men. So coronary heart disease is the most common type, killing over 370,000 people annually. Every year, about 735,000 Americans have a heart attack. Of these, 525,000 are a first heart attack, and 210,000 people have a second heart attack or have already had one heart attack. So, in other words, it's very important that we recognize the signs and symptoms. This is going to be a bulk of our traffic that comes in through the emergency room and that we see in our ICUs. A lot of times the patients that we have a comorbidities between pulmonary disorders and cardiac disorders. You may also get to work in the cardiovascular ICU. So the more information that you know and you're exposed to and that you get added to your knowledge base, the better RT and stronger clinician you're going to be. So let's talk about some of the basic key words that we're going to see on the board exams and that we need to be aware of so that we start planning to fix these cardiac issues. The first and foremost is our basic terminology like tachycardia, which is a heart rate higher than normal, so anything over 100 beats per minute. This can be caused by anxiety, someone is scared, and other emotions. It can be caused by stress. But on the board exams, tachycardia needs to trigger you to place the patient on oxygen. It's associated with hypoxemia during the exam questions, and so the first step you're going to do is place the patient on oxygen if they have tachycardia. The other end of the spectrum is bradycardia, a slow heart rate. We may see that with some spacing more than normal on the EKG monitor, and we can give medication if needed to correct bradycardia, and we need to know what those medications are. Now we have to keep in mind some people have bradycardia naturally, extreme athletes and people that have been training for a long time may have bradycardia, and so you need to be aware of that when you're assessing a patient. So take all things into consideration. Another sign and symptom and key words of cardiac issue is cold, clammy skin. That can trigger us to recognize that a myocardial infarction may be occurring. We want to give oxygen and do an EKG in order to assess what our rate and rhythm are of the cardiac system, so we know what steps to take from there on out. Anything, of course, that says marked or severe triggers us to know that's an emergency, and we need to address that quickly before moving forward, especially on the CSE. So no matter what terminology type you're looking at, you need to keep in mind that anytime the words marked or severe are in use on the exam, then that triggers an emergency, and you should stop and correct the problem, address it quickly. Another key word that we might see is orthopnea, which means the patient has to sit up with their head up in bed in order to be comfortable, and that is a sign on the boards of CHF. Cardiac drugs, proper fluid maintenance, and especially diuretics are going to help correct the congestive heart failure. So if you see orthopnea on the board exam, then you know that that is there to trigger you to begin a cardiac care plan that includes treatment of CHF. So, of course, our COPD patients often have orthopnea as well because they need their head a bed up. They can't breathe well lying flat. But on the board exam, keep orthopnea kind of reserved for your CHF patients. So, general malaise is another potential key term that tells us there might be an electrolyte imbalance and we need to fix that. The sodium, the potassium, or other magnesium, other electrolytes may be affected. Sodium and potassium especially affect the rate and rhythm of the heart. So we need to correct either a higher or lower potassium or sodium, etc. So general malaise is a key term that points us toward an electrolyte imbalance, and that just means the patient doesn't feel like very chipper, their normal level of energy may be higher, but all of a sudden they're feeling tired and just kind of like Eeyore, just thanks for noticing me, not really feeling so well today. That's general malaise. So another key term that should point us toward a cardiac issue is diaphoresis. Anytime we see diaphoresis, which is a medical term for profuse sweating, the patient's just kind of dripping, their hair may be moist, they have sweat beads on their forehead and on their face, and maybe their clothes may also become moist. So just keep that in mind. Diaphoresis is a key term that tells us there may be heart failure, fever, or if it's happening at night, if they're having night sweats, they may need tested for tuberculosis. So address whatever the underlying problem is, and cardiac-wise, it can tell us the patient is in heart failure and having an impending emergency. Also, another key term is fine rails. Fine rails tells us there may be some congestive heart failure and pulmonary edema. We need to treat that with diuresis, provide positive pressure ventilation, IPPB, use cardiac drugs such as digitalis to increase the pumping action of the heart. So watch for the word fine rails and go ahead and initiate a care plan for CHF and pulmonary edema if you see those words. The butterfly and bat wing pattern on the x-ray also triggers us to think of pulmonary edema. We need to treat that underlying problem. So a lot of times that's CHF as well, and those same diuretics and digitalis and positive pressure is going to help clear that. Fluffy infiltrates is something else we might also see mentioned from a chest x-ray. Again, that tells us there's pulmonary edema. Flattened T waves on the EKG tells us there may be hypokalemia or low potassium. Spiked T waves tells us there may be hyperkalemia, high potassium. So we want to look at those enzymes and get that corrected as soon as possible. We may also see a pink frothy sputum that tells us that the patient may be experiencing pulmonary edema, which in the root of that may be a cardiac issue, CHF. So just keep these in mind. Know that these terms are there to encourage you to think along a certain clinical picture that you should be familiar with. And hopefully this is helpful to you. And if you have any questions, just send us a message or leave a comment below. Make sure that you hit subscribe so that you can be notified when we have other helpful videos posting. So have a great day. Thanks for listening.